Hi and good morning, everyone, both in the room here or in webinar land. My name's Jeff. I'm the director here at Insights. It's my great pleasure to welcome you to our webinar today. Before I go along, I'd like to acknowledge the traditional owners of the land of which we're gathered today and pay respects to elders past, present and emerging. We're in the lands of Meanjin here and of the Trilobul and the Yagara people, but I also extend my respects to wherever you are across Australia and the lands of which you are today. We've got a great presentation today, and one of those topics that affect all of us, but is particularly important in relation to our work with clients or patients where substance use is concerned. We've got Lisa Cutforth, who's the Chief Clinical Nutritionist and Director of Food Services with the Banyans. And she's here to talk to us today and share her knowledge and wisdom and experience around the relationship role of stress nutrition and neuroscience in the treatment of behavioural addiction. So please join me in welcoming Lisa to the stage. Thank you, Lisa.
Good morning, everyone. Thank you for being here and for the invitation, Jeff. Just a quick little introduction on who I am. So that is me, or that is I. This is the Banyans where I work. That's actually the view from the kitchen. So it's absolutely my favourite part of the house. So what we specialise in is we're wellness residents, specialising in behavioural addiction, dependency, trauma, and just mental health and recovery, basically for a high-end group. So we're a 9-bed residence, so quite small. We are expanding and growing into a Bowen Hills clinic, a day clinic program as well. So my background is in nutrition and psychology. I did a Bachelor of Science with honours in Edinburgh in Scotland. I'm from South Africa, that's what my accent is. And basically I've also done some studies in neuroscience. And so today that's why I'm going to talk about the relationship between those three, because obviously in this cohort that we're working with people with addiction or dependencies, it's very often there's this relationship between neuroscience, stress and nutrition, and that's what I'm going to talk about today. So just to get a sense of who my audience is in the room, is just so that I know who I'm talking to. Who's in the room with me here?
We have some medical and some allied health.
Medical and allied health. Okay,
yes.
Welcome. Thank you. It's always helpful for me to know who I'm talking to for a bit of context. So is that slide showing up? Yes. Okay, good. So I just wanted to talk a little bit about this relationship between stress, nutrition and addiction. Basically, these arrows can go both ways. There is definitely a relationship between stress and nutrition status and behavioural addiction or dependencies or maladaptive coping mechanisms. And again, both, as I said, that can go both ways. So just to unpack the relationship a little bit in kind of layman's terms, is stress can affect our mood. It can also affect our behaviour and how we experience life. It also affects our nutrition status directly and indirectly. So, for example, without good nutrition and your key essential nutrients, people can't be physically well and they can't be mentally well. And also, stressed and malnourished people, stressed people often don't eat well and malnourished people don't feel well. So there is this link that kind of cycles through. And basically, recovery is more probable when we use the right support tools and treatment. So I just wanted to start with a little bit of neuroscience. So the key organizing principle of the brain is to kind of flag information that comes in as either pleasure or pain. And it's kind of organizing this information is filtered through our limbic system, the emotional center of the brain. And then we are flagging that as kind of a threat or a reward. And basically there's three kind of areas that we can class that information in. And one is anticipation. So we might be anticipating hope, or we might be anticipating fear or disaster, right? The other we might be belonging. So that's kind of acceptance or rejection. And the other one is sensation, so pleasure or pain. And the interesting thing about the brain is it doesn't seem to differentiate between emotional and physical pain. So the same areas, and if we look at brain imaging, the same areas of the brain light up in response to emotional threats as they do to physical threats, or emotional pain and physical pain. So it's just really interesting to understand that from a kind of behavioural approach when we're trying to look at how do we deal with recovery and look at solutions. So also just to unpack from a stress response, the body has this response to stress, and And basically, it's protective. It's designed, your stress response is designed to be protective and basically to help you kind of save your life if you are under a life-threatening stress or risk factor. And it does this in kind of different ways. So one of the things that it does is you're conscious, if you'll be aware of like fear, anxiety, or stress, okay? Arousal, you'll obviously be aroused, you'll notice your heart rate goes up, you move faster, you're able to move faster. Very often people get sweaty or things like that. That's arousal state. We have defensive behaviors, so we might fight or flight. We have the sympathetic activation, and we have this HPA axis activations. We've got a bit of biochemical and physiological changes. We've got pain suppression. So often that can be like you can hurt yourself, but you can still, when adrenaline kicks in, you can still be able to move through those different pain at the moment. Obviously the pain comes later then. And then obviously it's designed to learn for learning. We're very good at learning from bad experiences, not always, and we remember them much more strongly than we would remember a positive experience. And a few things about how stress impacts the brain is there's cognitive, emotional, behavioral, and relational consequences. So depending on the state of your brain or how stressed your brain is measuring. So let's say that there were 5 different stages of states of the brain, and there's consequences to how stressed your brain feels. It changes the way you think, it changes the way you feel, it changes your preferences and your decisions, and it also changes the way you interact with people. And so that is really relevant also when we start to think about our client that we're working with and we're trying to interact with and the context of their lives. Also on stress there is this physiological component to stress. So initially, we have this initial stress response, which is an increase in cortisol and something called DHEA. But after prolonged distress, so once it moves from acute to kind of chronic stress, you have these physiological and biochemical changes that happen, and your body kind of goes into adaptation. So instead of it just being this acute response, it's kind of, you have this increase in cortisol and DHEA, and that starts to fall. So even though you're still in stress, you have these hormonal changes. And at the end stage, you'll often see people are feeling really exhausted, burnout, and those physiological consequences of this ongoing stress. Does that make sense? Okay. And so basically, stress changes our biology, our psychology, and our behavior. And so if we're looking at just the behavioral symptoms to start, so if we're considering things like behavioral symptoms, and the reason why I'm going there first is because often with addiction and dependencies or drug use or those sorts of things, we're seeing these are behavioral symptoms, and we're trying to understand them. But you will see the stress response, and sometimes it can look like eating more, sometimes it can look like eating less, sometimes it can look like sleeping too much or sleeping too little, sometimes it can look like isolating yourself from others. Is there an issue? Okay. So sometimes it can look like procrastinating or neglecting responsibilities or using alcohol, cigarettes, or drugs to relax. And sometimes it can look like nervous habits. So, and then obviously the physical symptoms as well, aches and pains. You can have these bowel changes, so diarrhea or constipation. Some people get like IBS symptoms. Some people get chest pains, rapid heart rates. You often see that as panic attacks where people think that they're dying or they're having a heart attack or something like that. And very often these can start from ongoing stress symptoms. So obviously all these together become these triggers for dependency and addiction. And very often we see with our cohort or the people that are coming to us for health, we're seeing these previous trauma, we're seeing chronic stress, we're seeing a pattern of maladaptive coping in the face of stress. And that's because when a threat response is coming through that limbic system, the emotional center of your brain, and you're flagging it as threat or reward, it's actually changing. Your brain then will, if you can't physically do something about this perceived threat, you will then try and soothe, comfort, or distract yourself from the pain or the threat. So very often then you have this maladaptive coping. So someone will be like they're in pain, so that they'll look for something to soothe or comfort or distract that. So sometimes people eat, you'll see emotional eating, like eat ice cream for happiness or whatever, something like that. And that's okay if it's occasional, but when it becomes this habitual thing, then it's a maladaptive coping. And obviously in terms of like drug use or alcohol use, very often alcohol use, it starts as just kind of one and then progresses to more and more and more. And there are reasons for that and further explanation. I'm not going to go into that in this talk, but also about just other triggers. Is very often we see this biological and biochemical imbalances. So particularly in the line of work that I do as a nutritionist and a clinical nutritionist, I'm really interested in this biological and biochemical imbalances and how we can use those and influence those positively to change the way that people are feeling and behaving as a direct consequence from their biochemistry, if that makes sense. And then also genetic factors. So that's really interesting, looking at different genetic studies. And we definitely do that a lot at the Banyans, but looking at their role and how we can translate those into different or use those to inform different therapy. So one of the things, if we're trying to understand, again, dependency and addiction and different behaviours, is looking at the ACE test. I don't know if everyone's familiar with that. It is quite a well cited piece of research. And it basically refers to the adverse childhood experiences. And basically, a lot of our cohort have had these, child abuse or experiences of abuse or neglect or early stress or trauma events. And very often that there is this link with those adverse childhood experiences that will lead to early initiation of alcohol use or higher risk of mental and substance use disorders, or adoption of health risk behaviours, greater risk of disease, and even increased experience of depression and suicide. So I just wanted to cite that because obviously that there is this, a lot of the work that we do at the Banyans with psychologists and psychiatrists and many of our therapists is to try and unpack and unravel it and deal with or resolve some of those early experiences, and so that people can learn different ways to cope and recover from stress or through that trauma and move forward. Does that make sense? Rather than turning to substances or things to try and distract themselves or soothe or comfort themselves from those. So I'm flicking now to nutrition, and just because the relevance of this pathway, what we're looking at here is basically the pathway to make noradrenaline and adrenaline, and this is called the dopamine pathway. So if you look at, the reason why I'm showing you this is because nutrition is involved in every single step. But if you look at our intake of dietary protein, so we eat food, so protein, so maybe eat some meat or some eggs or some beans or some legumes, you get this dietary protein, you break this down into different amino acids. And involved in that, even that first step, is B6 and zinc, which is helping to make different digestive enzymes. For example, your hydrochloric acid, you need zinc. Then breaking this down into phenylalanine and different amino acids at each step of that to make those different neurotransmitters, dopamine, for example. You're using different vitamins and minerals. I'm South African, so I say vitamins, not vitamins. But just so that you know that's just illustrating that whole pathway at every single step. So if you are deficient in anything, obviously it's going to be really difficult for you to make key neurotransmitters. This is just one neurotransmitter, dopamine, and that actually is also your stress chemical pathway. So noradrenaline and adrenaline are the things that you will release in response to stress. So also on that slide, as you can see how then if you are stressed and you're diverting blood and away from your digestive tract, which often happens because you get these physiological changes. Obviously, a stress response is wiring you for fight or flight. So then you get these secondary symptoms. So you're not trying to digest your food when you're fleeing from a wild animal. So for example, let's take the extreme of that example. And so what happens is you have this digestive compromise, but also if you're stressed and you're not eating properly, which is very often the case, you're then going to have a lack of these key nutrients and also an increased load of these key nutrients. So very often people with substance dependencies or alcohol use will actually, because of the substances, change their appetite as well. They're inclined to eat less, or they will prioritize the substance over eating. or if they've got any money, they would rather spend the money on the substance rather than food. So you do see these patterns which dramatically impact people's nutrition status. But I just wanted to show you that pathway because that's the stress pathway. And again, adrenaline is made and secreted by your adrenals, and your adrenal glands, you have 2 adrenal glands, and basically they can get depleted in times of stress. But one of the key vitamins that they rely on is B5. So it's easy to see how these increased nutrient need in times of stress. And it's also easy to see how our mood is affected by poor nutrient status, because if you can't make the key neurotransmitters that are affecting mood, for example, serotonin or dopamine, like in that pathway, obviously that's relevant. Now, again, the reason why I showed you a dopamine as a neurotransmitter rather than some of the others, and I'm sorry, this is very sciencey and biochemistry, so I hope I'm not really losing anyone. But basically if we look at dopamine, the reason why dopamine is so important is because it's one of those key neurotransmitters involved in pleasure and reward, but also arousal and stimulation, and helping us remember or reinforce the use of different drugs, for example. So let's say if you have a substance, all you need is dopamine to reach high enough levels in the ventral striatum, which is a part of the brain, in order for you to be more inclined to do it again. And then obviously the more times you repeat a behavior as well, you've got other parts of your brain that help you, create habits and remember to do things again through behavior chains and different triggers and routines. So basically it's dopamine that starts that whole addiction cycle, but then also other parts of the brain will help reinforce it. But dopamine does play a key role in addiction. But also the other thing about that is when a brain is stressed and you're looking for things to soothe, comfort, or distract yourself from pain, very often you're looking for the things that would increase dopamine. So there's drugs, sex, rock and roll, alcohol, and sugar. Those are the things that are highly reinforcing in there that are going to help raise that dopamine level. So if we're thinking about recovery and how to help people recover, one of the things that we wanted to focus on is basically helping them find more effective ways to cope, right? And so from my perspective in this talk, we're talking about 2 different things. From a neuroscience perspective is helping them find different ways to self-regulate through stress. So we can't always remove stress from people's lives, but we can help them find new ways to cope with different stresses and react to different stresses and recover from different stresses. Does that make sense? And then also we can support their biochemistry and their nutrition so they don't become so depleted, and so that they're at least functioning on a baseline, and obviously if you've got a better mood, you're able to cope with stress better. If you're not in pain, you're able to cope with stress better. If you're not hungry, you're able to cope with stress better. So if we just take care of the basics, we can usually take just the edge of it and just help them get a bit further down the road, if that makes sense. So I wanted to just talk about a neuroscience tool that I use a lot with my clients. And one of the things is just basic breathing. So you'll notice even now I'm talking very quickly, and so that I'm doing a lot of breathing right up here. But what a self-regulation breath that's going to help us recover from stress is to take a deep breath. Now, many people are familiar with mindfulness breathing techniques, or, the breathing in the square. But a self-regulation breath is slightly different in that you're taking a deep breath and then you're doing a long exhale. So let's say if you breathe in for 5 and you exhale for 7, or breathe in for 6 and exhale for 8. So let's do it now. I just want you to and if you do just 3, you should notice a subtle change in your physiology. I can notice in mine straight away. So that's something that I do for myself every single day, multiple times during the day. I do it as part of a little check-in. So when people are really stressed, I'll encourage them to do it on the hour. So for me, it's something that I do every morning and evening. I do it every time I'm in the car. I do it every time I go to the loo. I do it every time I sit down between clients. It's just something that I'm like, how am I doing, checking in, and then I'll do a little reinforcer, something called labeling, which is another technique. And I also do something which is just like affirmation, like I'm okay, and just recovering, because it's really important if we can just check in regularly, early and often, if we can take the edge off reaching that kind of brain state where you're so stressed, you're kind of just withdrawing from life. That's what we want to do, is a little bit of stress we can cope with, but if it gets too far down, we can't even make good decisions. A different part of our brain is making those decisions, so it's really hard to make good decisions when you're very stressed. So it's basically just buying yourself some time, and just kind of recovering your physiology so that you get back a bit of control of your brain. And a little bit like digestion being blood being diverted away from your digestive tract and stress response, kind of the same thing happens with your brain, is your brain's prioritizing focus and attention to your limbic system, which is involved in quick decisions and quick, doing things quickly. It's not really concerned with the prefrontal cortex and the logical and reasoning behaviors and thinking. It's not really concerned with that. So by taking some deep breath and giving some feedback to our body and our brain that we're okay, you kind of send some blood and attention back to different regions, and just kind of, and what you're using is something called acetylcholine, which is like acts as a natural tranquilizer in your brain. And basically, you're using something called your vagus nerve to kind of release that. So the vagus nerve goes from your brain via your lungs and through to your stomach, basically, and in your intestines. And it's basically giving information. It's giving feedback it's talking between your brain and the rest of your organs and saying, like, are we under threat? Are we okay? Because those systems obviously are working together all the time. And so releasing this substance is giving some feedback to those parts that you're actually okay, and that releasing that acetylcholine acts like a natural tranquilizer. So the guy that discovered it, he used to call it vagus stoph, which is vagus nerve was the wandering nerve in Latin, so it's the wandering nerve, and this was the substance. And acetylcholine was actually one of the first neurotransmitters discovered. So again, on that gut-brain link, so I'll just segue to that, is there is this really important connection between the brain and the gut, and we're using, and basically 60 to 90% of your gut produces 60 to 90% of your neurotransmitters. So that's like GABA, norepinephrine, dopamine, and serotonin. So it is really important, and it plays this key role in being able to produce and create these things that are really important for the brain and to govern mood and behavior and all sorts of things. So if our gut health is compromised, obviously that's going to make it really difficult to create those. But also on that, it's also your gut-brain connection is also, your gut is also involved in your immune health, and also in this vagus nerve, and this kind of calming, giving this feedback about where you are and what's going on for you in your life. So just talking then about this connection between nutrition and mental health, is nutrition's often neglected in kind of treatment when it comes to addiction and recovery. And one of the reasons that I wanted to talk about this is highlighting 5 different key points. One is nutrition starters can contribute to mental health issues, including depression. People with mental health issues often eat well, like I said, they'll either eat more or less. Also, people with addictions don't usually eat well or have good nutrient starters. So the type of food or the quality of food is usually not optimum. They might be going for more sugary foods, or so stress changes our preferences. So we're more likely to prefer sugary food. It also changes our tolerances, and we're more likely to be able to overeat kind of fatty foods. So it does have this impact on kind of our preferences around eating. Also, alcohol, medications, and drugs can negatively impact on gut health and nutrition status, and I'll touch on that in a little minute as well. And also, stress compromises our digestion. So as blood is diverted away from the digestive system during fight or flight, I've already touched on that point, but obviously that can have an impact on nutrition status and our ability to digest our food and get nutrients from that. So all of that, I hope, presents a bit of a case for clinical nutrition testing. So one of the things that just highlighting, touching on kind of the kind of diving a bit deeper into that. If we looked at even just the top three, so B12, B6, and folic acid, which are all B vitamins, if you look at, you can see that if you were depleted in B12, one of the consequences of this nutrition depleting can be depression. B6, one of the consequences, depression. Folic acid, one of the consequences, depression. So if we just look at those three, and then vitamin D, one of the consequences, depression. So it just being low or depleted in B vitamins and vitamin D, just basic vitamins, you can have an increased risk of depression. Okay, so, and then if we take that further and we look at medications, so let's say that somebody is also on, maybe they're diabetic, and they're on metformin, or maybe they're on some aspirin or some NSAIDs for pain, and then we further depleting them in B12 and folic acid. So this is not uncommon, obviously. Has anyone ever had a client who might be deficient in B's and D and might be on pain meds or an antidepressant? Most of us have come across a client like that, and so that we can have this further depletion. And then also, if they are smoking can also further deplete, like vitamin C, certain antioxidants. It also acts as an appetite depressant, which can obviously negatively impact people's eating. And then alcohol can deplete you of certain B vitamins again. And one of the really important ones is thiamine. And then opiates, again, calcium, magnesium, Bs, amino acids. So this is just a tiny little snapshot, but I hope it brings home the point that, depending on what's going on, you can really become depleted very easily from key nutrients. And if we look at the link between psychiatric disorders and substance abuse disorders, very often there is a depression link. So the reason why I'm now talking about depression, even though we're talking about dependencies and drug addiction, is there is often this comorbidity or this link between depression and these different substance uses and dependencies. So addictive behaviors. So one of the things that I've learned in kind of 15, 16 years of practice is that there is no one size fits all. So it's very difficult to just give you a basic nutrition plan that would just touch everybody in the right way. So that's why at the Banyans we do a lot of clinical nutrition testing, and because there is no one size fits all. And so we do a whole suite of quite comprehensive testing, apart from me sitting down and chatting with people and taking a clinical history and family history of health and basic diet diaries and things like that, and nutrition eating log. We're also doing a suite of tests, including DNA testing, and then other tests that, like organic acid testing, neurobiogenic amines testing, and we're looking at different food intolerances, liver function, homocysteine, vitamin D, basically a whole bunch of tests. So I don't really have the time today to go into all of those tests, but I just wanted to talk about two specific kind of nutrients or markers that I'm looking for. And the reason why is these two are really easy to test, like just a GP could just order these tests. They're not difficult to test. And they are quite relevant, helpful nutrition markers because they give us a little bit of insight into those nutrients that I spoke about earlier, for example, depression, and B9, B12, and vitamin D status. So if we talk briefly about the implications of these two. So for example, with vitamin D, I'm just going to have some water here. So vitamin D has a key role in immune function, bone health, muscle formation, and mental health. And a lot of, the assumption is that we live in Australia. It's a really hot country, especially Queensland. We live in sunny Queensland. None of us would be deficient in vitamin D. Actually, probably about 1 in 4 Australians are low in vitamin D. So it is one of those things that's really important to test for. I'm not suggesting everybody go and lie in the sun all day, but obviously morning and afternoon sun, maybe 20 minutes is probably helpful. But sometimes, because there's a genetic component to this, very often some people will have to take a vitamin D supplement. So I just wanted to talk about vitamin D deficiency. And we can actually test for it. So I will show you one, but I'll get to another slide in a minute, and in a pathology test. But basically, I just wanted to draw your attention to why it's, so we do a bunch of testing. So I don't just test for, pathology. I test blood, saliva, urine, those sorts of things. So this is a neurobiogenic amines test. And if we looked at here, so this will look at kind of levels of dopamine, serotonin, and other amino acids up and down the pathway that are secreted in the urine. And it gives us a bit of information about people's basically neurotransmitter status, if you like, but based on the kind of organic acids or key amino acids that they're excreting. So if we looked at this and we're looking at serotonin, we'd see that this person appears to be low in serotonin. They've got low serotonin and low 5-HIAA, but then they've got a little bit elevated tryptamine. So without going into all of the detail of that, I might just assume that they're low in serotonin and then think, okay, well, we just need to find a way to increase their serotonin. However, if I understand this data, and I'm doing multiple different bits of testing, and I also notice that there's a vitamin D deficiency, that's the more I could have, if I didn't look at vitamin D status, or I didn't look at all the different pathways that are relevant, I might assume it's just to do a serotonin, whereas in actual fact, in that case, it was more likely to do with this pathway here, where tryptophan is turned into 5-HTP, which requires vitamin D. And because if you looked at the tryptophan, the decrease in tryptamine could indicate a tryptophan deficiency, and increase in tryptamine may indicate a vitamin deficiency. So because that pathway is vitamin D dependent. So one of the things that we do is we look at multiple different pathways to try and find what are the nutrients that we need to be making those different that are acting as cofactors to make those different chemicals that we are relying on in the body, if that makes sense. So vitamin D is a really good one to check. And also, and because it's involved in so many different pathways, if it's low and we correct it, we end up subtly changing lots of other pathways. Does that make sense? And so the other thing that I like to test is homocysteine. So homocysteine is basically an amino acid, and it's not that interesting or relevant on its own, except that what we do to it is we break it down and we make different things from it. And if it accumulates, it can be a bit destructive. So this is actually a client at the Banyans, where we looked at when they arrived. They had, sorry, the slide's a bit hard to see. I don't know if you can see it, but on the 20th of May, he came in and it was sitting at 14. Because I hadn't got any of the other data yet, straight away I could see that his homocysteine was elevated. I just put him on a B complex, just a basic B complex, because he was very stressed, had been stressed for a long time, and had been drinking quite a bit. And within basically about 2 weeks, his homocysteine had already started to decrease. So obviously he had decreased his alcohol intake and increased his Bs, just two things in eating well, sleeping well, and residence. So it hadn't changed other things too much because I hadn't got the results. So basically what we do is we test and then we respond to what we're seeing, and then we test and we respond to what we're seeing, and then we're building a picture. And then by the time somebody leaves, we've got a pretty comprehensive program for them to correct those imbalances. But looking at this pathway here, if that's homocysteine, which we're testing, basically we turn homocysteine and turn homocysteine to methionine. Methionine, we use something called SAMe, and we break basically homocysteine down to make SAMe as well. And we need B12 to do that, and we need B9 to do that as well. And then there's kind of 400 different reactions that go out of that. But one, for example, and we're also making, like up the pathway, making SAMe. So for example, you turn serotonin into melatonin. So serotonin, kind of your calming, happy hormone, is often referred to. It's a neurotransmitter that we often see low in depression. And serotonin, you turn into melatonin, which helps you sleep, right? So if you're missing SAMe, you can't turn serotonin into melatonin as effectively. So SAMe is important, for example, just in that pathway. And then if you look at homocysteine here, homocysteine also is turned into glutathione. Glutathione is involved in detoxifying your liver. So just kind of two key things that homocysteine's involved in. And we know that if homocysteine's high, usually it's giving us clues about which nutrients we might be deficient in. So before I've even got to the point where I'm able to test like genetics and MTHFR and whether they have that gene or not and the complications of that, I can just look at homocysteine and see, well, what can we assume about how many bees they have access to, how well they're using their bees, are they using B9 and B12 well, is this accumulating or is it not? If it's accumulating, we can make assumptions that it's not, these pathways are not working that well. Does that make sense? And obviously there's lots of different factors that can increase homocysteine, but primarily, including, drinking too much alcohol, but also even being a vegan, for example, because you don't have enough B12, sometimes your homocysteine can go up. So looking at, I'm not really going to talk about MTHFR too much here, but just to talk on that point, MTHFR is an enzyme and it produces 5-MTHFR. So basically we convert a portion of folate and folic acid into folinic acid, and then folinic acid is turned into methylfolate. And we use that to perform different functions. So if we're looking at homocysteine's role in health and disease, the brain actually, there's relevance because of how that impacts the brain. And there's a whole bunch of literature and research around the different impact of homocysteine, including things like, how it affects heart health, how it affects your brain, how it affects even Alzheimer's, Parkinson's disease, risk of dementia, depression, those sorts of things. So when it accumulates, because of the knock-on effect of all those different pathways, it's a really good indicator of disease. So I'm not talking even about causal risk here. I'm just looking at what can we look at as pathways that are giving us clues about people's nutrition status that we can influence in order to help them feel well, function better, and affect their mood and behavior. Does that make sense? But also give them, a better chance of long-term health. So basically, for the relevance today, for the function of today, if we're talking about breaking homocysteine down and using homocysteine, it's basically dependent on B12 and B9 and some other things like zinc, TMG, and a few other factors, but particularly B12 and B9. And again, linking back to depression, again, there's this body of evidence that shows us the importance of bees in the role of depression and optimizing treatment. So again, I'm not going to read through all of these, all this different literature, but here's one again, which references homocysteine and SAMe and folate and depression. This one again, the B9 and B12 link with depression. And again, so there's lots. And then risk factors with low folate and alcohol and depression link again. So basically, simply put, nutrition status affects mood and behavior. So if we look at tryptophan is an amino acid that we turn into 5-HTP and then we turn into serotonin. And then phenylalanine, it's hard to see here, but anyway. So again, those are kind of key neurotransmitters, serotonin and dopamine, and involved in those, you need B, vitamin C, zinc, help those conversions, and then something called TMG and SAMe help make these conversions, and then omega-3 fats improve neurotransmitter reception, and those are all key mood-enhancing neurotransmitters. And again, again, coming back to the role of nutrition and the relevance is if we don't have enough of those nutrients, we can't make those key components and those pathways don't work. So we can't physically be well because it's a little bit like trying to make a cake without all the ingredients. You just can't. So how do we assist with detoxification, recovery, and cravings? I get that a lot from, doctors or different clinicians that just want, could you give us a summary? So as I've explained, it is definitely not a one-size-fits-all approach. Nutrition can't be. It doesn't work like that. However, some of the key nutrients that I've seen that do make a difference is obviously the right diet, and the right diet for that particular person. And there's different things that we look at to try and influence that. But certainly sometimes these are some of the supplements that I have found that help. And probably one of the most harmless ones you can give someone is a B complex. It is a water-soluble vitamin. If it's not in its activated form, they can take it every day after breakfast. So you'd always take these after breakfast, not on an empty stomach, otherwise people can get a bit nauseous. But just generally, in times of stress, or when people are going through exams, or people, something major has happened in their life, maybe they're getting divorced, or maybe they're moving house, or maybe there's extra work stress, or maybe they're going through a pandemic. Just adding some B vitamins can really make a difference. In winter, even getting vitamin D status checked and just topping it up. So as a nutritionist, I'm looking for vitamin D at about 80. The clinical reference range is about 49. So a doctor will check, and as long as it's about 49, they'll say, you're fine. As a nutritionist, I'm saying, let's go 80, because you can still get bone density issues and things like that at under 80. So, and because it's involved in so many pathways, it's really important. And we're going through a pandemic at the moment, so let's support our immune system as well. And if you're deficient, that's a key nutrient. So even if you're going to start somewhere, B vitamins, it's a good place to start. Obviously, vitamin D is a fat soluble, so you can store it and accumulate it. So it's one that tested before you just add it, don't just add it. And same with zinc. Zinc minerals, you don't want to just add minerals without testing first. But certainly a B vitamin, if you're taking it every day, you're just going to urinate it out if there's excess. And then also, so just to summarize some kind of key points, connections, and take-homes, is stress impacts the brain, decision-making, and behavior, and that can feed into addiction, addictive behaviors, dependency behaviors, in maladaptive coping. Neuroscience lends insight into pain and reward networks, maladaptive coping in the face of stress, pain, or trauma, and using self-regulation as a tool to better recover from stress. The key neurotransmitters involved in the stress response, addiction, and mental health, for particularly anxiety and depression, are namely serotonin, dopamine, and acetylcholine. Those are the ones that I spoke about today. Nutrition's role from a biochemistry perspective and its involvement in making neurotransmitters which affect mood, behavior. And today we spotlighted 2 markers that can affect mental health and depression specifically, and the gut-brain connection and the importance of gut health from a nutrition and psychology perspective. So that was kind of nutrition, neuroscience, and stress in a nutshell. So
well done. Well, we've got a bunch of questions.
Okay.
Any questions from the room first before we go into the ones online?
Can I just ask, where is the Banyans?
it's an undisclosed location, because we do get people that require confidentiality. So obviously everybody does, but to a higher degree. So it's kind of the outskirts of Brisbane.
It's Brisbane.
It's Brisbane based, yes.
So people want to jump straight to the answer. What diet should I eat to get all of these nutrients?
Okay, good.
A couple of questions around what's the best kind of multivitamin to recommend, and you're saying like a B complex breakfast, so thank you for that. And what are some of the natural foods that might contain the tryptophans or the B vitamins themselves if getting a patient or client to take a multi is not possible?
Okay, good.
Yeah.
So what's the best diet? So the best diet is the one with whole foods, the most whole foods. So at the Banyans, we operate on kind of a basis of a whole food diet. So eating as much whole foods as you can, mostly from plants. Certainly there's lots of benefits to a plant-based diet, even if it's not a vegan or vegetarian diet, definitely lots of plants. And that includes legumes, beans, those sorts of things, which do have those B vitamins and certain amino acids. In terms of tryptophan, turkey, chicken, meat, well, that potassium, bananas. So if you're eating a whole food, plant-based diet, and supplementing some meat, some chicken, some fish if you want to. And then also, one of the things that I think is really important from a gut health perspective is something called rotation, which no one really talks about, but it is important to have a varied diet. And it's important for two reasons. Is one, you give yourself the best chance of getting most of the nutrients and vitamins and minerals into your diet, and macro and micronutrients if you eat a varied diet, especially if it's a varied whole food diet. But the other thing that happens is you decrease your risk of getting kind of food intolerances, which if you're eating a monotonous diet, like let's say every day you eat toasted cheese sandwiches, breakfast and lunch, or, and then for dinner you have egg on toast, and that's kind of like your diet, which sounds kind of healthy. But let's say that over time your gut gets irritated because of the zonulin and gluten or something like that, you can actually decrease your nutrition starters because you're negatively impacting your gut health. So don't eat a monotonous diet if you can avoid it. So one of the things I say is, so the positive around that is rotate your food. So if you're eating bananas today, have apples tomorrow, and have mandarins the next day. If you're eating wheat-based toast today, have rye toast tomorrow, and then have oats for breakfast the next day. So you rotate your grains, rotate your fruits, rotate your beans and your legumes, rotate your meats, rotate your proteins, rotate your vegetables. Broccoli today, Brussels sprouts tomorrow, everybody's favorite, spinach the next day, kale the next day, and green beans the next day. So basically just rotate your foods and have a whole food varied diet if you can. And then also the obvious one is, if there's something that you're eating and it doesn't agree with you for whatever reason, and it doesn't make you feel great, or even if you really, really don't like it, don't eat it. Try and eat the foods that you like, that are the healthy foods, if that makes sense. So that's the diet one. And also those will be the green leafy vegetables, beans, legumes, and things like fish, chicken. Even if you ate those, that's kind of some of those Bs that I spoke about today, and those amino acids, they're abundant in those.
There was a lot of interest in the table which talked about the interactions of the nutrient depletion according to certain substances.
Okay, shall we try and go back to that?
Yeah. They were wondering if that information was available for other substances such as stimulants or maybe the benzos, because I think you talked about opiates, alcohol.
Yeah, so yes, it will be out there. I haven't tabulated it yet. And again, because I'm testing, and because I'm trying not to make assumptions and blanket approach, like I'm trying not to rely on just a table where I'm just making an assumption that everybody who's smoking will be low in vitamin C. So there are some dangers to making general assumptions, but absolutely there are, every single class, for example, even like Nexium, which is a really common one, people that take Nexium should be supplementing B12 because it is basically impacting your ability to use that. So.
And is there a reference to this, or this is stuff you tabulated yourself? Yeah,
so this one particularly tabulated myself. This is just, from I've just gathered lots of different papers over the years, and sometimes when I talk, I'll just accumulate from different ones. Oh, well, this is interesting. This is showing up a lot, or from my own experience, something that I see a lot of is, so these are so some of them may have started from somebody else's table that I've just built up. So no, there isn't a reference, unfortunately. I'd love to refer you to one where it was all neat and tidy. I haven't found it, but it might be out there.
Yep. Is it common practice to assess vitamin D with vitamin K2?
Usually, so some supplements will include K2 with vitamin D. We don't always, it's not even common practice to assess vitamin D. So, yes, you can try and assess it together. And I don't. I'm looking for specifically vitamin D starters and then going from there. Sometimes I will supplement D and K2 together. It's probably a topic for another day.
So I'm just going through all of these questions. Anything about the role of coffee depleting micronutrients?
Yes, so I'm glad you brought that up. So yes, absolutely, coffee can. it kind of binds to certain minerals and things like that in the gut. So I do say to people, try and drink your coffee away from food. Especially like things like iron, your minerals, definitely can't, you don't want to have coffee with your meals. And it's very common people have breakfast with coffee, not a good idea. The other thing about coffee is don't have it at the start before breakfast. Everybody likes to wake up with the coffee. Try and eat something, try and have a cup of herbal tea and then have some breakfast and then have your coffee later in the day, because otherwise you're just going to be chasing your insulin all day. So just because of that stress response and because of that cortisol rise, it just puts you on the back foot for the rest of your day. So definitely caffeine does impact certain key nutrients. So yes, have it away from food if you're going to have it, preferably because of the way it affects your stress cycle. Try and have coffee in the morning rather than the afternoon. Try and limit your coffees to 2, not more than 3 a day. And as I said, not first thing in the morning, not before breakfast, and definitely not after lunch, although people are usually looking for that pick-me-up around 3 p.m. So if that is you, I would say you really want to look at the way you're eating and your different stress cycles and the way you're recovering, because that is impacting your energy levels. So rather, if 3 p.m. you are feeling a little bit sleepy, take a walk, go and get some fresh air, have a licorice tea or a peppermint tea as a bit of an upper, start your day, even a Barocca, which is not really, it's got all sorts of nasties added to it. But, in terms of don't overdo the coffees, rather take a B complex after breakfast if you're finding you're needing a 3 p.m. coffee. The easier way to kind of give yourself a bit of a pick-me-up is a B complex.
There are a lot of questions here, and I'm going to say we're probably not going to get to all of them.
That's okay.
For those people online. There is a question around...
People could email me as well if they've had...
That would be great. So if we don't get to your question, we apologise. There's a lot here. Any comment on the differentiation of serotonin production in the gut versus the brain and vitamin D status? Oh, and I think you just made a comment here about food intake versus supplements and the difference in terms of the preference to get it from food as opposed to supplements.
Yeah.
The difference in metabolism and absorption, I guess.
Yeah, so arguably, that's why the focus is on whole foods. It is better if we do try and get our nutrients from whole foods. The reality is, in this cohort, if people are severely malnourished and all sorts of things, it can be really hard for them to even get started and get back to a baseline. So some people with compromised gut health and that can go all the way up the chain, even to like zinc deficiencies and things like that. Sometimes we'll give them supplements just to kind of pick them up and try and get them to a baseline where those pathways are activated and functioning, and then they're better able to absorb their food. So I'm not suggesting at all that we rely on supplements, but absolutely I use them when necessary. And very often in this cohort, because people become so severely depressed, malnourished, nutrient depleted, then it becomes necessary to supplement. So yes, my preference is for whole foods, but sometimes supplementation is necessary.
What's your thoughts on fasting?
Oh, that's a good one. Look, there's a lot of research and evidence to suggest that fasting has benefits. I am not an advocate for kind of some of the fad diets, including, it's intermittent fasting and things like that. The reason is because, and I'm not saying that they're bad for everyone, but they're certainly not good for everybody. And so what I say is absolutely have breaks. So don't eat after a certain time. So let's say if you stopped eating at 7 p.m. and then you only started eating it at 7 a.m. again, that's probably like an adequate 12-hour fast. But in terms of genetics, there are some people that, for example, have a gene that makes them more prone to snacking behavior, or that they have more prone to sugar cravings, or that they have different day and night rhythms that can elevate ghrelin, which is a hunger hormone. So for someone like that, if they're on a fast, what will happen is when they're out of the fast, they will be more inclined, or they score low in satiety. They're more inclined to overeat when they come out of the fast because they've been fighting cravings all day, and then they'll overreact to that and they don't regulate it as well. So some people genetically are just not wired that well to deal with that kind of eating. Some people, though, respond really well and love it. Again, that's the case for individual nutrition testing, or at least even going to somebody like me who can ask you really good questions about the way you like to eat, and then kind of use that to gauge which diet might be best. So that kind of rationale applies to everything from keto to, you know, all the different types of diets. One is not necessarily going to fit everybody. Keto can work really well for weight loss initially, but longer term longevity studies, you know, it's not the best marker of overall general long-term health because of the way it impacts the gut health and things like that. But there's a case for some, you know, for example, if someone has brain cancer or epilepsy, sometimes keto diet can be beneficial for them. So again, every single diet has its little place, but certainly as promotion of overall just health markers as a fad, you've got to really do it very carefully to do it well, and you've got to know a lot about yourself and your nutrition status in order to do it well.
So everyone needs their own personal nutritionist.
That's right.
Thousands of you running.
That's right, yeah.
Excellent. And look, there are questions about that which we can't answer, about how do people access nutrition in the public health system. And I think that's probably through primary care.
Yeah, so probably they would be able to access dietitians, or through referrals, so GP referrals and things like that. There are lots of nutritionists out there. Not all nutritionists will do clinical testing like this to this level, but certainly, you know, definitely they will be able to give you different advice that can help direct you.
Yep. Any comments on microbiome and ideal amount of gut microbiome?
So again, your microbiome is again so personal. But so in terms of would I recommend that everybody take this amount of probiotics? No, but certainly I do support that your microbiome, especially a complex microbiome, is very beneficial. And it's so interesting, like even looking at research. For example, there's one of my favorites is about like a rat or mouse study where they took a sterile mouse that was bred in a lab and only handled with like, you know, gear, you know, like masks and gloves and everything else, completely sterile environment. And then they took one from like a field mouse and they gave them a mercury solution, and the field mouse only absorbed a tiny % of the mercury, where the sterile mouse absorbed just about all of it and died. So again, your microbiome is very protective. It's even protective against things that we wouldn't have thought it could be protective against. So certainly against viruses, bacteria, even helping us eliminate certain toxins from our diet and our food intake. So there is this microbiome role. It's very involved in creation of serotonin, creation of B12, creation, you know, like they're involved. And our microbiome is so sophisticated. It's adapting to our environment all the time. And your environment there, you are creating by what you eat. So in stool analysis, when we're looking at different stool, we can see basically the type of diet someone's eating based on their microbiome. So for example, if they're eating a meat-heavy diet, different microbiome grow than if they're eating a plant-based diet. And so it's really interesting to see how that plays out in their health. And again, there is this genetic component as well, that different people function well in different diets.
Yep. I've got one quick question, which I'm not sure, Doris, I'm sorry if I'm asking this correctly, but which is to seek clarification around, and I'm going to assume 80 nanograms or NG or NMOL for vitamin D3 status. So I'm not, maybe Doris, if you could ask that question in more layman's terms.
Oh, so she's talking about 80, yeah, so.
Is that probably an ideal kind of?
Yes, yes.
D3?
Oh, no. So 1,000 international units. If I was going to give someone a supplement, I was just talking about the clinical markers, and I was sorry because I thought I had a slide in there particularly for vitamin D, but I haven't.
Maybe Doris, you could email.
Yes.